Well, good morning, everyone. We have a small but mighty group in the audience, and we have several folks on Zoom as well. So I want to get started, and thank you for joining us. If you're just beginning your day, I hope this is the best way to begin it. And if you're ending your day, I hope it's a great way to end it too. So my name's Arnot Wiley. I'm the Chief Operating Officer of Arnot Health, and I'm going to be talking to you today, and I'm going to pull off my mask with Diego Carandini. Diego is the Vice President of Human Resources, and I want to thank our colleagues from Human Resources as well for being here. We're very excited to talk to you today about our employee engagement survey results. I'm kind of trying to change my language from employee engagement to employee experience, because what this really looks at is what it is like and what the experience is like to be a colleague and a worker here at Arnot Health. And, we all completed this survey. And so it gives us a real opportunity to provide feedback, as well as identify opportunities and make recommendations. Oops, I'm not sure which one. I'm going to try to advance the slides here. You know which one I did? Oh, there we go. So today, this is just a high-level overview of the things we're going to be talking about. We're going to talk a little bit about the survey background and some are high-level summary. Diego's going to take us through some of the more granular detail of the results. We're going to also talk in some degree of detail about the comments. And I've said this in all of the sessions we've had, the comments are really a gift. And when people, again, and I took the survey, when I circled the box or checked the box that this is my answer, all that tells me is that this is the answer. It doesn't tell me the why, what your experience is, why you answered something the way you did. So the comments really were able to give us a level of insight that we normally would not be able to have. And then finally, we're going to talk about recommendations and next steps. Well, I'm not sure. Just trying to move forward. Hold on just a moment. This one? Yep. Who did it? Me, probably me. Okay. All right. So why is this important? Why did we do this survey? We did this survey as part of an overarching dream and goal we have of becoming a high-performing organization. And when we talk about a high-performance organization, we talk about a healthcare organization that provides very high-quality care. We provide safe patient care. Our patients have a great experience, even during sometimes the most difficult points of their life. And we, as an organization, are providing all of us with a work environment where we feel respected, valued, where we are provided with the tools and resources we need. We're supported by our teams, and we're supported by our direct supervisors and the entire organization. And so what the survey did was give us an opportunity to look at our experience as employees in 3 different domains: the organization domain, manager domain, excuse me, and the employee domain. In terms of the organization domain, we're really looking at how the organization does in supporting our experience. In terms of manager domain, we're looking at the person that we all directly report to. Do they care about us? Do they value us? Do they recognize us, et cetera? We'll talk a little more about that in detail as well. And then employee domain. How engaged are we? What is our experience as an employee? Am I proud to work here? Do I like the work I do? It's all about me, and it's all about you individually giving us the feedback from your own personal perspective. So just by way of background and to kind of remind us of where this started, in the beginning of October 2022, we sent out this survey electronically. We were thrilled. 76% of the employees in this organization completed this survey. We're considering this a baseline survey. I've been here almost a year and a half, but I understand it's been many years since we had the opportunity to conduct this survey. So many things have changed. Many things change from month to month, but we're really considering this a new start. and seeing where we're at right now, Prescaney executive team came in to share the results with our executive team right around Thanksgiving time. And what they said is typically when an organization does what they consider a baseline or first survey, on average, organizations are having about 50% response rate. For us to achieve, 25%, 26% more than that is really exceptional. And what we know is that when people take the time to give the feedback, there's a couple things happening. First of all, they've got something to say. They feel safe to say it, and they have a trust that someone will be listening and making improvements based on what they say. So thank you for doing that. It was really wonderful to see. There were 35 questions that we all completed. Took about 15 minutes. And if you see the blue boxes up on the screen, it really the questions dove into some of those key areas, whether it's quality and service, our feelings about leadership, our feelings about teamwork, safety, and so on. We had a choice when we completed each question to really answer in one of 5 ways. When the question was asked, did we strongly agree or did we agree with that question? Were we neutral? We didn't agree or disagree. Kind of, we're in the middle of the road. And typically those employees are having really a variable experience. Some days may be great. Some days you may be pulling your hair out. And then on the lower end of the scale, do I disagree with that or do I strongly disagree with that? And those employees, really, their experience is quite negative, particularly in the strongly disagree categories. We committed that the survey was anonymous, and I can 1,000% assure you that it was. We at this organization have no way of knowing who by an individual person completed a survey, what your survey responses were, and what your comments were. What we do have the ability to do, and we need to have this ability, is to roll up results to a department level so that when the laboratory is looking at their results, they're really looking at what all of their employees said. And that's pretty easy because they've got about 90 employees. But any department that has less than 5 employees, it's pretty difficult to have anonymity. And so in order for us to ensure that, those results really rolled up to the next level. And I'll give you an example here. So the sleep lab, for example, has 3 employees. So they couldn't get a sleep lab specific survey. They report up through the Heart and Vascular Institute. So their results will be blended into a larger group. Still very helpful. However, it is something that, again, we really wanted to make sure that people felt safe and felt that they were anonymous. We then provided 3 open-ended questions. Give us one suggestion that you would recommend to make Arnot Health a better place to work. Also a question, what do you like most about working at this organization? And also, just as important, what do you like least about working at this organization? And this is really where we were able to gain some insights. We got over 1,300 comments to each of these questions. It was about 60 pages long. And I can tell you that Diego and myself, Jonathan Lawrence, and members of the executive team have taken many hours to review in detail every one of those comments, because that really gave us specific information that we desperately need in order to make meaningful action plans. Diego will be talking more about that with you all. So just like when we were all in school, we get a grade. And the Prescaney methodology gives us as an organization an overall engagement score. The lowest we could have received was 1, and the highest we could have received was 5. As an organization, our overall engagement score was 3.7. Now, I should also tell you that because we're able to kind of slice and dice the results, we are able to get separate results for the medical center, for St. Joe's campus, for Ira Davenport, as well as for the Arnot Medical Services. Because although we're one system, we have different cultures, we have different ways of being with each other. And so this gives each of those areas an opportunity to look at their specific results. The other thing I would say is that I've been doing these surveys for many years, and I had a little internal bet in my own mind of where I thought our overall engagement would be. And I thought I actually would be closer to around a 3, kind of the middle of the road. So for us to be at a baseline survey with 76% response rate and a 3.7 on engagement is really a wonderful place for us together to begin to understand where we need to improve and, more importantly, deliver on that commitment and promise to improve. Press Ganey, I wanted to identify for us when they met with us in the senior leadership team what they considered some of our key strengths and opportunities. One of our key strengths was a very high percentage of our employees strongly agreed that patient safety was a top priority at this organization. That's very consistent with the safety culture survey we did last January of 2022. As somebody who spent most of my professional career in patient safety and quality work, this is very heartwarming for me. And as we look at the results, even folks who work in non-clinical areas, billing, maybe perhaps registration, areas like that, do see this as one of our key focus areas. Another area that Press Ganey said we were a very positive outlier in, particularly at a baseline survey, is the experience that employees have with their direct supervisor. Nearly 50% of our employees rated their direct supervisor at the highest tiers, and we won't get into that, but there were ratings for the management team. And for 50% of our employees to say that their manager cares about them, cares about their job satisfaction, recognizes them, helps them, is concerned about their work-life balance, and is an excellent communicator and promotes teamwork is really something that's happening here that is very special and really not like what's happening elsewhere throughout the country. And Press Ganey is the largest engagement partner really in the world. So they have a very rich and robust database and are able to help us compare ourselves with other organizations, learn from other organizations where they may have addressed an issue we might need to address, and have the ability to connect us with other institutions that have successfully been working on these issues. In terms of opportunity, although we all recognize that patient safety is the top priority, our ability to deliver on the promise of exceptional high-quality care that's error-free and safe is something that there's a bit of a disconnect. And you're going to see that in some future slides. And we're going to talk more about what our work to improve that will be. And then finally, although the managers are really supporting a very healthy work environment, and we know that employees innately want to go above and beyond for their patients and for their team. And we see this every single day. Every single day I see this. There's something within the organization, within the structure, that is not connecting. And so that's concerning. And we really want to learn more about that, be able to address that. And then finally, communication. Communication is probably the word that was used most, if we did a word search, most common in our entire survey across the entire enterprise. We really need to improve our communication channels, our listening, our communication within departments and across departments, communication between doctors, nurses, other members of the care team. This is not a surprise to me. This is typically one of the most common areas in all hospitals who survey, but we particularly have opportunities to do that here. And the good news really is that we don't have to reinvent the wheel. There are evidence-based ways to work on communication that we can work with all of you and our entire organization to improve. We're going to break down some of the tables now. And as we talked about it previously, you had the opportunity to answer in one of 5 ways for each question. But for ease of trying to coordinate and collate those results, Press Ganey really identified things in 3 buckets. Percentage of respondents to each question that rated those favorably, and that means you either strongly agreed or agreed with the question. Percentage neutral, I call those the fence sitters. I neither agree nor disagree. I'm not sure how to answer this. And then those that were unfavorable. I strongly disagree or I disagree. So although we answered 35 questions, There are 6 questions that really are the overall barometer of engagement. And those questions looked at things like, overall, am I a satisfied employee? Do I plan on working at this organization 3 years from now? Would I continue to work at this organization even if I was offered a similar role elsewhere? Would I recommend this organization to friends and colleagues who are looking for a new place to work? Am I proud? This is where this is very personal. Am I proud to say that I work here? And then finally, this is really looking at the clinical care. Would I recommend this organization to my family and friends who need care? So this is how we got to the overall engagement score of 3.7. As you look at the individual scores, and you can read that, the ratings across for each score, the engagement score, was pretty consistent. The percentage of unfavorable responses to those 6 questions actually was pretty low, 9% to a high of 13%. So not many people are really having what we would consider a lack of engagement. The percent of favorable, people who said, boy, I am knocking it out of the park. I am very engaged. My experience is very good. Really 60 to 65, probably an average of about 64%. But there's a high percentage of people that are right in the middle. They're not sure. They're probably still waiting. They weren't able to say that things are great. They weren't able to say that things are not great. And those are the people, about 28 to 30% overall, that really we want to learn from and understand what it will take so that their experience really does move. This is, by the way, is not to move a number. This is a quest to improve our experience and ultimately improve in the areas of high reliability. One of the things that was very important to me, and we asked Press Ganey to take some of the safety culture survey results. Again, we did that survey in January. I think we got the survey results mid-February. So we had a few months to work on some action plans before we resurveyed again. But we did ask 6 to 7 questions. We repeated those. And Press Ganey tells us that any score, any question that moved 0.03, either one way or the other, is considered a statistically significant movement. After we got the survey results back in February from the safety culture survey, we worked with the departments and about 125 action plans came out. There were a number of departments that really needed a lot of assistance in this area based on their results. And we held specific department feedback results with those teams. We interviewed all of the employees within that to learn more. Again, when you just have a number, just have a checkbox, it doesn't tell you what's really happening. And so as we look at those departments that were really, I consider, in some degree of distress, and we worked specifically with them, in the vast majority of these questions, we did see an improvement. Overall, there were 2 questions across the organization that we did see a significant improvement, and that was related to the area of staffing and trying to deliver error-free, safe patient care. And even though those 2 areas increased significantly, what this tells you, because this is still a key opportunity for our organization, we still got a long ways to go, but tells me that we're heading in the right direction. So that's terrific. And I think we're going to capitalize on some of the processes we use to continue to work on the results from this survey. But there were 2 areas where we significantly declined, even since February when we rolled these out. And that is people feeling that within their own department, people are working well together. And also people feeling that across and between departments, people are working well together. We have the ability to look at those department level results and see where we need to work with those teams and also between teams. What Press Ganey has shared with us, because they've been doing this, so many years and have thousands of organizations that they work with, that since COVID was, among us, that virtually every organization across the United States has declined pretty significantly in this area. We've all been under, I'm not going to tell you anything you don't know, a high degree of stress, both personally, professionally. And I think as a society, safe to say we've not always been at our best behavior. People, a lot of hostility, people feeling free to be rude. I'm not talking about this organization. I'm talking about life. And so this is unfortunately what we're seeing spilling over into the workplace. And so, the results of this survey give us the chance to work together to hit the reset button on all of that. I'm going to turn it over to Diego now, and he's going to take you through kind of some of the nuts and bolts of our performance. Thank you.
This one. Good morning, everybody. So we're going to go, as Arnot said, a little bit deeper into the detail of some of the questions, and then we'll also look a little bit at some of the comments and the themes that came out of that. So the first thing before we get into the questions themselves is there's this concept of a key driver, and we're going to talk about that. And where does that come from? As Arnot mentioned, Press Ganey has healthcare clients all over the country. They have data scientists and all sorts of experts on, statistics and how to analyze information. And what they do is they're able to tell us from how that information comes together, which of the questions that we answer are most important in terms of their impact on our engagement and experience. And so if you recall that slide we had that Arnot shared with the, excuse me, 6 questions on engagement, there's 6 questions on engagement and there's 29 other questions to make the 35 multiple choice questions, right? Those 6 questions on engagement are kind of output questions. They're really not questions that you influence directly. You influence how people feel about those through what you do on those other 29, right? You get recognized. You feel that your communication is good. You feel that you're being rewarded, that you're able to expand and grow your career, things like that. But whatever questions are in those 29 are going to then influence the 6. But some of those 29 may be more impactful in how they influence those 6, in how people feel on those 6 engagement questions. So before and I apologize that the titles are kind of covered here, but basically, this is the highest performing items, right? So this is from a pure score perspective. Which items did we score the highest on? So you can see that, again, if we look at that kind of the columns of unfavorable, very, single digit numbers here. And even in the middle, the neutral is, around an average of 10 or 11%. So 80 to 85% are positive. I like the work I do. That's great. We all want to be in a place where we enjoy the work we're doing, so that's great to see that result, over 90% on that one. The others are actually around the manager theme in terms of that manager-employee relationship. So it's good to see that that's working well, right? Most people feel that they're treated with respect by their manager, that they respect their manager's abilities as a manager, and the things that they bring to the table. That manager cares about their job satisfaction, and that person encourages teamwork. Out of those 5, you'll notice that one of those is has the key next to it. So again, what that means is it doesn't mean that the others are not important. They all are important. But if you compare them all, the one that is more likely to influence how people feel from an engagement perspective is the one around that manager caring about the employee's job satisfaction. So we're going to look at the 5 lowest scoring items as well. So a very different picture here. And you'll notice that now we have 2 keys that, again, that from the Press Ganey science, they tell us are the most important in driving the engagement experience. But before we get to those 2, let's talk about the 3 in the middle. So the environment in this organization makes my unit want to go above and beyond what's expected. We saw that in the theme from one of the charts that Arnot showed earlier. Again, that's an area that we want to understand that better, right? We want people to feel that level of enthusiasm and energy, and again, you use the word engagement to be able to work with their teams and work with the people that they work with across other areas to really exceed and excel in their roles. Staffing and pay are also on this list, as you can see. And this is both, I mean, this is typical in many surveys. Many organizations are going to have staffing and pay as lower ranked questions because it hits home very directly, right? But again, obviously they're low here, and we want to obviously impact those. The fact, I just want to make this point really clear, the fact that they're not key drivers, as I said before, does not mean that they're not important. We engage in staffing and pay. So I and members of the HR team are involved in staffing and pay issues every single day, multiple times a day. And we continue to always look at how we're paying people across the organization, what strategy we can use in terms of pay to make it both affordable, but make it impactful for individuals and for departments and for specifically, as we look at different jobs and how they're paid compared to the market. Staffing, again, we've looked and we continue to look. These results don't change our direction in continuing to focus daily. They do impact in the sense of making sure that we are clear that we are going to always continue to have this focus, even though it may not have a key symbol next to it, right? In terms of looking at staffing strategies and the best way to make sure that in all our departments, we have the people and the resources we need to get the job done and to excel in that job when it relates to things like quality and safety and patient care. So now going to the other two, again, we see the same theme here. We just kind of highlighted the word communication, right? We have two flavors of communication here too. And again, we see the communication issue kind of cutting across a lot of different parts of the organization. It's across some of the clinical areas, right? Physicians, nurses, and other medical personnel. And it's in general, different levels of the organization. So that could be a mixture of clinical and non-clinical, people that feel that way. The oval here is circled around both columns here because we have a lot of work to do to take the actions that need to be taken so that people have the experience and that the questions, when they get these questions asked again in the future, they're reflecting differently. And hopefully the things that we do in the future are going to have those people who are on the left-hand side move towards the middle, and those that are, having answers towards the middle feel more that they're agreeing and strongly agreeing. Any questions so far? Any of that? So now we're going to take this science again. This is Press-Ganey science, and they've really refined this over the years. They've gotten more sophisticated. They've taken these questions and what they do is they plot them kind of against this grid. The x-axis, is that the x-axis? No, that's the y-axis. The one going up and down is about performance. So that the higher up a question is, and we'll see some circles that represent some of our survey questions on the next chart, but the higher up you go in this grid means the stronger the score was, right? More people were agreeing and strongly agreeing. The arrow going off to the right means it's more impactful, right? So the ones that tend to have the keys are going to be more off to the right because those are the questions that we want to make sure that comparing all, when we're prioritizing, that those are the ones that we know are going to drive the overall work experience a bit more than some of the others. So breaking these down again into these kind of four quadrants, if anything is on the upper right, that's great. That's where we want to be, right? We're scoring really well, and it's something that is impactful to the work experience. So keep doing it, encourage it, promote it, drive it, further and further to keep that progress. If it's something that's on that focus quadrant, right, that means we're not performing that well, but it is relatively more impactful to the experience. So we really need to focus on those items. That's where a lot of our action planning is going to be, addressing those items. And then the ones on the left, again, maintaining, great. Something is we're doing well. It may not be quite as impactful in engagement, but we want to continue to do it, right? And then evaluate. Well, those are the ones that we're not doing as well. They may or may not be as important to driving engagement. So again, relative to other things, it doesn't mean we're going to ignore them, but we want to keep an eye on them and want to see where there may be some opportunity there. And you'll see that again, It's not that you just go right into one box or another. Where these circles are kind of move around in the boxes. So what you see here is, I'll start with the one that has the arrow and the oval. We asked a question in the survey, which is not in the standard set of questions, interestingly enough, but we specifically wanted to have it in there. Information from this survey will be used to make improvements. And we did well on that one. And it is an important question from Press Ganey's results and what they tell us, which is great, right? Because that tells us that people have faith in the process. This gets back to the point about the 76% participation, the over 4,000 comments. People are invested in being part of this engagement and experience journey, and they're looking to work with their leaders. They have expectations of senior leadership, and they are looking at how they're going to work and have a work experience with their department and with other departments that they interact with. The question, there's a question about work life, which is number 2 there, which is the one that kind of straddling that line. So again, generally a good result to have. We're happy to see that. And we want to continue to, focus on that and make sure we promote, strong support for work-life balancing. The questions on the bottom, again, some of the themes that we've looked at a bit about quality, around error-free care. There were 2 in there that we still really need to understand a little bit more. We kind of got these results and they were a little bit perplexing. The concept of respect, it could mean a lot of different things to a lot of people. So we're really going to try to understand that further at an organizational level. It may or may not. It's going to have in some departments, it's going to obviously come out because those departments drove results. So at some departments, it may be an issue, but we need to really look at an organizational level as well. Same thing with ethical manner. No one wants to feel that we're in an organization that's not ethical. So what does that really mean? And why did people have that perception? The other 3 questions that are kind of clustered just have a 1, 2, 3 that are in that lower left box. Again, they're in that box, but they're very close to the box on the right. So we want to pay attention to those. And sure enough, if you look at those are all communication questions. So Press Ganey did say to us that they're important. And we didn't score as well as we need to be scoring. All right. So again, I know there's kind of small writing here, but communication, again, same questions that we saw before around communication across the kind of clinical, some of the clinical areas, physicians, nurses, and other medical personnel. And then different work units working well together, which also probably has a lot of communication related issues. And different levels of organization communicate effectively with each other. So similar questions, probably some similar themes there. So this, what this does is this takes so if I go back just a second, let's see if nope, I bet I shouldn't have done that. This takes the 9 questions, the 7 that were in red and the 2 that were in that upper right box. And that's kind of the breakout of the score of those scores. If we look at all our questions, that's our starting point. Again, it doesn't mean we don't look at the others, but that if we're going to start prioritizing and coming up with themes, we want to really focus on these. And again, we see the ones around communication. And again, this concept of respect, quality, error-free care, and then promoting the top 2, right? About the follow through on using this information to make improvements, and focusing on and promoting the work-life balance of everybody. Again, we have this large group in the middle that we really want to make sure that we're doing the things so that those people in the middle have that experience when they look at this, in a future survey and they say, you know what, I wasn't sure, but now this has now consistently been an improvement in my area. So we're going to talk about the comments a little bit. The first slide is a real high level summary of, oops, oh no. Oh, good, the wheel works. This is a high level summary of the 3 questions in the pie chart. Again, the science that Press Ganey has, they take comments and they break them into categories. Kind of difficult to do, right? Because someone might say, what do you like most about working here? My schedule, 2-word answer. Someone else might say, have talked about 5 different things to any of the questions, right? They could be talking about staffing, They could be talking about the condition of the building that they're working in, how they're working with their colleagues, their manager, et cetera. So they could have a lot of things, and Press Ganey does what they can, and they do a nice job of it in breaking those into themes. So sometimes one comment will have 4 or 5 themes tagged next to it. And then those themes get rolled into these categories here. So workplace comments, that first one, again, over 1,300 answers for each of these 3 questions. So we have over 4,000 total comments. Workplace, colleagues, I'd say by far and above the greatest positive thing that people talked about in the comments is their colleagues. And you'll see some of that in the examples that we'll share about working their coworkers, the work environment that they have kind of at that work unit level. Patient experience, being able to, provide care for patients. Compassion, morale, feeling, appreciated, feeling that they're in a positive situation. Again, this is the first question about what do you like most about working here. Intangible benefits. It could be the schedule, it could be their PTO, their health benefits, things like that that are kind of grouped into one. Again, we're trying to take 1,400 comments and put them into categories. So it's going to have some kind of generality. And then of course, there's going to be other comments as well in other category. I think the big takeaway from this chart though, as you look, the next 2 are what do you like least, and then provide one suggestion, right? So now the pie shifts a little bit. Now workplace still comes up as a theme in both, but it's not as big of a theme. So that's good in the sense that, you don't like your workplace. We like to have people say workplace is in the positive, right? Resources and compensation now appear in both of those charts, right? In those pie charts. Again, not surprising from what the results we've seen already about how people scored those questions. And then there's some other categories. Leadership shows up in that bottom one, which is a really important takeaway, especially for the senior team and the work that we're going to be doing, which Arnot will talk about in a few minutes. That bottom question, again, most people took the time to give some very thoughtful impact or ideas about what to do, some solution-oriented, comments. And leadership visibility, leadership communication, definitely were some of the themes that fit into that slice of the pie there. So the next 2 charts are going to look at specific comments. These are verbatim with maybe in some cases we changed a word or 2 just to make sure that it was protected, that no one would, kind of feel that they were being exposed. What do you like most about working with this organization? I don't know. Can you see these from the back or not really? Not really? I'll take a minute here. You can kind of, if you're close enough to read, go ahead. I'll just pick out some kind of phrases from some of these and some of the themes. So the team-based environment, is one of the themes in that first comment. I love the human side of Arnot, the care about each person, the organization, understanding, and we feel like a family, right? So there's those comments. Receiving recognition, the dedication of the staff, the patience, that is what we are all here for. That's a nice, just succinct kind of comment that just talks about that. My team, my coworkers, my department, the person I report to is respectful, caring, compassionate, wants to bring out the best in us. A very nice summary comment there. Then there's a couple of other themes: networking, educational opportunities, flexibility of a schedule. So a lot of different ideas put into that one. I love the family atmosphere. My team is great, and the supervisor is the best I've ever had at Arnot. So again, a lot of themes there that we talked about, and those are brought out in some of these examples. And the next chart combines some of the answers to the question, what do you like least? And also, please provide one suggestion. Before we actually look at some of the content in here, I just want to call out that on the upper left hand, you have 3 words here. You have pay, staffing, and communication. And you'll see that they're in a rectangle and that there's a few sort of symbolic rectangles behind them. The reason for that is because those 3 themes were very present in these answers. But in terms of kind of bringing forth the flavor and the spirit of what is in these questions, we wanted to also show you some of the other things that were out here, including some of the ideas. So there's a lot of, so those are symbolic to represent that a lot of the comments were around pay, around staffing, and around communication, which we've identified. If you look at, again, some of these specific ones, some of this is around inconsistent in communication, different, depending on, you get communication at the last minute. And it may depend on who you get it from. So you get different messages from different people. That's obviously going to be disruptive to the work environment. It's going to be less productive. It's going to be, more challenging. Better communication between departments, lack of recognition for work being done. So the flip side of the comment we saw from the other chart. Some of the ideas are sprinkled in here as well, right? Mandatory daily huddles in every department to improve communication, leave cell phones at the door. Cross-training between units, right? So some very productive ideas. Committees made of management and employees where problems were hashed over, right? And then, again, concerns about standards of behavior, so accountability is a theme that comes out of some of these as well. Any questions or thoughts around any of this? Okay, so I'm going to turn it back over to Arnot. She is going to take us through the next steps.
So I think we all took the first step, and that was giving our feedback, taking the survey. But make no mistake about it, in order for us to meaningfully impact the experience that we all want to have, it's going to require a mutual commitment. It's going to require a lot of working together, trying different initiatives, getting our feedback to see if those things are really making the impact that we want to have. And so I really see this as a transformational journey that we will all be undertaking. But there are really three different areas that will be addressed in order for us to do this. The first is the things that we need to do at the organizational level. What does senior leadership need to do? First of all, I can guarantee you that the entire senior leadership team is 100% committed to making improvements. This really gave us an opportunity to look in the mirror and look where we are and where we want to be, look at how we're leading, how we're communicating, how we're showing that we value employees. We are overseeing kind of the nuts and bolts, the timelines for disseminating the results, the work that the individual vice presidents will be doing with all of the departments that they work with. And we are creating, probably going to meet next week, an executive engagement committee. And this is where we'll be developing really the high level action plans and the things that we need to do so that we are holding ourselves accountable, because we certainly are accountable to delivering on the tactics and initiatives that we'll be specifically undertaking. The last two circles below that are leader improvement planning and team improvement planning. Within the press gaining methodology, each department is going to be able to look at where they stand in terms of overall leadership performance and overall team performance. And this is where we really get the insights of what is occurring within each individual unit, and really want to recognize and celebrate those teams that are all working together, those leaders who are providing an exceptional work environment for their teams. And, I call them, full throttle leaders. And although we talked about earlier in our time together, about 50% of those leaders are working really at those highest levels, we have some that need our help. And we really see this as an investment in leadership development and also team development. So there will be opportunities for us to work with individual teams and individual leaders. And much like we did in the patient safety culture survey, one size does not fit all. One team may need to work on, communication within the team. nursing, and pick on two departments, nursing in acute care units and nursing in the emergency department may need to work together cross-functionally to improve their teamwork and communication. So we will be providing support and resources for those teams and for those departments. It's going to be a lot of listening. I think the worst thing that, whether it's this survey or anything else, is somebody assumes they know what's going to fix something. So that is definitely not the secret sauce to improvement here. So in terms of really the themes to elevate our experience, teamwork, communication, really respect, and high quality error-free care, those are the areas that we really need to focus on and understand, not only at an organizational level, but in an individual department and team level, what the current state is, why it's that way, and how we can assist in improvement. So some of the things that you can expect from senior leadership is consistent visibility and partnership. We are a large organization, and many departments are 24/7. We have to do this in a very meaningful way. It's difficult to see everyone every day, of course, but there are methods, there are best practices, and we're going to be learning together as a senior leadership team how we can best implement those things. Improving and reinforcing communication channels. We're an organization, I'm not really sure why. I think some of it is because it's hard. We don't all use email as common form of communication. That's a little different than other organizations that I have worked in before. So when we put out email messages and we think they get to everyone, we know that there's a fairly significant part of our population that either hasn't set up an email account, set it up and can't use it, or has one and never opens it. So it really, going forward, will be an expectation, everyone, but I can guarantee you our main communication method is not going to be email. We have to communicate in many ways, and that's part of the work that senior leadership will be working with our departments on. We also are going to be doing what I call some listening tours. We have many people who've worked here for many, many, many years. We also have new people who have fresh eyes, who are coming to us from one, maybe two or more other work experiences. We want to learn from you all. What has worked for you in the past? What have you seen in the past that we're not doing here? And for those, what I call wisdom workers, those that have been here many years, the good old days, how are things different? And are there things that even in a much more complex environment, larger teams, larger organization, that we should consider resurrecting? And then finally, we really want to celebrate. There are many teams and many leaders who are doing things very, very well. There are many teams who are delivering very high quality, error-free care. We have examples of that every single day. Sherry Todd's here from NICU, and I think of really that department as really one of the gems in terms of high quality, high reliability. And how can we learn from how they work as a team, how they train their staff, how they come together. After the safety culture survey, when we really saw the disconnect between the belief that patient safety and quality is a priority and that we're delivering on that promise, we began a weekly newsletter called Quality Matters. It's great. It highlights the wonderful things that we're doing, some of our successful outcomes in that space, but also some of the recognitions that our teams have well deserved. But again, if no one's seeing it, if no one's reading it, it's really not really achieving that goal. So clearly we need to do more. And this is our last slide, and I want to thank you for all your attention. This is just an overview of the timeline. There's two tables here. This is our last right now planned town hall. We've had really good attendance over the past couple weeks. When we went to IRA, The room was completely full, standing room only. We're considering going back and doing another session. St. Joe's, same thing. Many sessions here where many folks on Zoom, many folks in the room. And we're open to going to departments and also sharing this if there's a request. The next step is department feedback sessions. Next week, we will be training our leaders on getting into the Press Ganey portal, being able to pull their individual results. We'll be working with them on analysis, and we'll be setting up times to work with the individual teams. From there, this is like a performance improvement project. We're going to develop action plans. We're going to implement them. However, one of the things that we're going to be doing is really not assuming because we've worked together to develop an improvement strategy that it's going to work. So you're going to see throughout the year maybe some what we call pulse surveys, maybe asking people to give feedback on a couple questions, or maybe it's through senior leader rounding, talking to individual departments that we're working closely with. How are things? Asking more specific questions than that, but really understanding if what we've intended to improve is really delivering on that commitment. And then we've already talked about the bottom table, and this is really senior leadership's commitment in developing an engagement committee, developing our priorities and our action plans, holding ourselves accountable, and then checking in with all of you. Are we, as senior leaders, delivering on that promise? So I want to thank you all for your attention. We really are looking for feedback, questions, comments. We've been getting a lot of them. I would encourage you to reach out to Diego or myself, either in person or via email, or, we've both got open doors and are willing to meet with anyone, anytime. We've had a number of our colleagues take us up on that, and it honestly has helped inform the way we deliver this presentation, but also some really exceptional recommendations for improvement from their own perspective. So I want to thank you, and really excited about this year. We're off to a great start. Thank you so much.